Good morning, everyone, and welcome to Munson Healthcare's COVID-19 press conference. Today is Tuesday, November 9th, 2021. My name is Diane Mihalik. I am the Chief Marketing and Communications Officer for Munson Healthcare, and I will be your host today. We do have a very full agenda today, so I will keep my opening remarks pretty brief. I do want to let you know that joining us from Munson Healthcare today will be Dr. Christine Nefsey, Dr. Christopher Ledke, Dr. Nick Torney. And then from our local health departments, we'll have Wendy Hirschenberger, Lisa Peacock, and Dr. Jennifer Morse. And then also joining us will be Heidi Britton from Northwest Michigan Health Services. Now I'd like to hand it over to Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare, with an important announcement regarding Munson Healthcare's pandemic level response. Dr. Nefsey?
Thank you, Diane. Just a quick review of our current data. You can see there that we still are trending well above the state in our percent positivity. And after a little bit of a plateauing reprieve last week, we are trending back up. Next slide. There you can see also between our last press conference and today, our inpatient COVID positive patients has increased dramatically. Next slide. And because of that, I mean, there you can see too where we've been trending. So right now, currently similar to where we were in our last spring surge, the difference being that those surges were pretty quick as far as how they increased and then declined. This one has been longer and a little bit flatter, which is obviously impacting the healthcare organization pretty significantly. I think the other thing to note is that the pediatric hours have increased significantly with this surge currently compared to where we have been in the past. Next slide. So because of all of those reasons, we made the decision to move our pandemic response plan stage to level red. It does say here when you read the difference is widespread community cases to overwhelming number of local cases. And I do want to just reiterate that it is not only because of the COVID cases that we are moving to level red, but the high acuity we're seeing of other patients as well as staffing restraints that we're seeing. All of those things have combined for us to make that decision. Next slide. So what does that mean? Obviously, we did not come to this decision lightly. This is, in fact, the first time in Munson Healthcare history that we have made that decision. Of course, this is the first pandemic we've all dealt with in 100 years as well. But, really, we felt it was in many ways a reflection of the work that we were already doing. So I think most people are aware that we've been really looking at what work can be stopped, what work can be delayed, what work needs to happen. And that's not just clinical work, that's all the other work that goes on as well. So basically what this means for us as an organization is we will be prioritizing the work that we do around COVID-19 care as well as our other urgent care needs. We will be scaling back services that allow us to pull personnel to support the acute care work that we're doing. So sleep disorders as an example, elective procedures, all of those will be scaled back and in fact, in many ways already have. And we may be adjusting the hours of operation. So we've already done things like adjust our dietary work in cafes and those kinds of things. We're also looking at how scaling back things in our clinics and labs, again, to support the urgent care for patients in the community, both for COVID and non-COVID. But that's stuff that we will be looking at on a daily basis to ensure that we continue to provide the same excellent care to our community that we have been. We will not be changing our current visitor policy just because we think we've found the right balance there of providing the support patients need without overwhelming our staff or our spaces. Next slide. And then lastly, we do know that much of this surge of late has been led by our children going back to school. So up to 20% or higher of the new cases we're seeing are in kids. So it is exciting for us to be able to offer now the COVID-19 vaccine for children age 5 to 11. That was announced last week for Pfizer, that those kids are available under the emergency use authorization. So we, along with our health departments and many of our primary care clinics, have opened up appointments for pediatric COVID-19 vaccines. They are filling very quickly, which is exciting. Many of those organizations are also still doing adult vaccinations, so both are available. And we would just say to please call your pediatrician or primary care provider to see if they are offering the vaccine. If they are not, there are many other options available to you. And even if they aren't, they are good resources for you to talk to if you have questions or concerns. But we are doing in the Traverse City area, a pediatric immunization clinic. Those appointments are currently filled, but there is a number there where you can put your child on a waiting list. We will continue to adjust our schedule and open up additional spots as needed. And then you can see there is a website if you'd like to go on and get more information. Again, our health departments, I think, will be sharing with you their approach to providing the pediatric vaccine. But the state, as well as our website, all have good resources on their internet site that you can check to see where you can get vaccines, either for your children or for other adults.
Thank you, Dr. Nefsi. We will have you back shortly after the other presentations for the Q&A session. And as a reminder, you can submit your questions directly through the Q&A feature if you're a reporter on the Zoom. Otherwise, submit them via Facebook, and we'll get to as many as we can at the end of today's speakers. Next, thanks, Dr. Nefsi. Next, I'd like to welcome back Dr. Christopher Ledke, who is one of Munson Healthcare's infectious disease experts. Dr. Ledke, Dr. Nefsi just mentioned the approval of Pfizer vaccine for children. What else can you tell us about that approval and the safety and efficacy of that?
Sure, thanks, Diane. So I wanted to kind of review how this vaccine got approved and how it got to this point. And I specifically want to kind of speak to the parents that might be listening, who might be on the fence or hesitant to get their child vaccinated. So I'm specifically speaking about the Pfizer-BioNTech vaccine for ages 5 to 11, which was the most recent approval. It's a bit of a unique situation in vaccine approval in that the vaccine itself is known to be safe and effective in an older population. There has been extensive safety data and study on this vaccine in other age groups, and we know that it is safe. It's actually one of the most heavily scrutinized therapies in the history of medicine. So that allowed us to have a little bit of a lower burden of proof for children. And one of the reasons this was delayed is because they had to kind of clarify the dose that would be effective. And the theory was that since children tend to mount a very robust response to vaccines, perhaps we don't have to give such a dose. Maybe we could give a lower dose and get an appropriate response. That would have major implications in supply chain and the ability to distribute this and potentially have a lower risk of side effects. So the initial studies were looking at a dose that was 1/3 the dose of that used in 12 and above, and they found that they had an equal amount of protective antibodies that developed and very few safety concerns. The most common that you would see, which would be with most other vaccines, pain at the injection site, low-grade headache, fever, things like that that last a day or two. Those are consistent with your body's normal response to a vaccine. They actually found a lower incidence of those minor side effects than what they had seen in the older population with the same vaccine. So they subsequently looked at in the real world, when this vaccine is administered to this age group, how often do they actually develop COVID? And this was looking at a population of about 4,500 children, and they found an efficacy of 91%. So it appeared to be extremely effective as well as safe. So with this data, the FDA approved it under an emergency use, and the CDC has recommended it. And again, it's a 10 microgram dose, so it's 1/3 the dose of the vaccine given in 12 and older, 2 doses 21 days apart, now being administered nationwide and of course in our area. And I think one of the aspects that's important for us to talk about is safety, because that seems to be a lot of parents' concerns. And I think what you're going to read about is the concern over myocarditis and pericarditis. In that, the reason that's a major concern is that in previous studies, it was found that males aged 12 to 17 had the highest risk of developing this rare side effect after an mRNA vaccine. So their incidence of this side effect was 54 cases in 1 million, which is 0.05%. So still very, very rare, but it appears to be a real correlation and happens to be a higher risk in a younger age group. Now, remember that the vaccine we are giving to 5 to 11 is 1/3 of the dose. It should also be noted that in those safety trials I was talking about, they did not have a single case of myocarditis or pericarditis. So from what we can tell, it appears to be very effective and very safe, which is excellent. And if it is worth anything, you should know that myself and experts in our field who have children of this age are getting our children vaccinated as soon as possible.
Thank you, Dr. Ledke. That's really great information. I also want to ask that you stick around for the Q&A session where we do have some other questions coming in related to why we're seeing higher infection rates in our community and some of the variants. So we'll get to that in the Q&A. Thank you for that update on the pediatric vaccinations. I do want to get to our next speaker. It's my pleasure to introduce Dr. Nick Torney, who is one of Munson Healthcare's infectious disease pharmacists. Dr. Torney, what can you tell us about, is there anything additional you can tell us that Dr. Ledke didn't cover? And then specifically, anything that you know about this oral therapy or this Pfizer pill that we're hearing about in the news as well? Welcome.
Yeah, thank you. Thank you so much, Diane, for having me. So yeah, I echo Dr. Ledke's sentiment about the optimism for this vaccine for this age group. Across the country, there's 28 million children in that age group that are, before this vaccine was introduced, are currently unvaccinated. This is a 10% of our population in the United States. And so it's extremely optimistic that we're able to vaccinate this group with such a safe and effective vaccine, what we know of right now. And I'll just mention that, there's questions out there about whether this vaccine, the Pfizer vaccine for 5 to 11-year-olds, can be given with a flu vaccine. And at this point, the CDC recommends that is the case. So these vaccines can be given together at the same visit, so they do not have to be separated. Also, I just wanted to add on to the idea that this vaccine is different than the other vaccine given to adolescents and adults. As Dr. Ledke mentioned, the dose is 1/3 of the dose, and there's just very minor differences in what the product is, the inactive ingredients in the product. There's actually less inactive ingredients than the other vaccines. And one of those common ingredients is polyethylene glycol, which is found in many other products. So that's really the only contraindication to this vaccine is an anaphylactic reaction or a strong immune response to polyethylene glycol. And then you mentioned some oral forms that are out there. And so there are some oral medications that are being discussed and studied for moderate to mild to moderate COVID-19. Pfizer is looking at this, as well as Merck, and there is another medication that is available, already available on the market, that's being studied as well. So fluvoxamine is one, molnupiravir, and Paxlovid. I won't go into details into all three of those, but it is promising that we're starting to see more medications that are being studied for the outpatient side for mild to moderate disease.
Thanks, Dr. Torney. That is encouraging news. Thank you for those details and that insight. I will ask that you also join us later for the Q&A session after the health departments and Heidi have a chance to speak as well. Thanks, Dr. Torney. Next up, we'll get to some of our local health department updates. It's my pleasure to welcome back Wendy Hirschenberger, who's the health officer from Grand Traverse County Health Department. And as a reminder, Wendy does not have the video capability, so she'll be joining us by audio. Welcome, Wendy.
Thank you. Great information from our infectious disease experts. I always appreciate hearing their insights. So similar to what Dr. Nefsey talked about, for Grand Traverse County, we have been seeing this gradual climb in cases. And then the last week or two in October, we saw sort of a plateauing, and we're hopeful at that point that we might see numbers start to go down. But the last 8 days have proven that actually we have shot up about another 40%. So we're seeing a little bit more dramatic increase right now for Grand Traverse County. For at least the last 8 days. So far November is actually heading more towards the highest numbers we saw, which were back in April of 2020. So we're not going in the right direction right now at all. So we've also seen a larger jump in the percent positivity. We were in the 10 to 12% range for probably 6+ weeks. Now we're approaching the 15% range for Grand Traverse County. And then also just a larger jump in our weekly number of cases. Next slide, please. On the vaccination rates for our county, we are still doing quite well with the adult population overall. If you look at the numbers, you're going to see the numbers have gone down, and that's because they now have included that 5 to 11-year-old group who are eligible for vaccine in the denominator. So if we exclude them, we're actually at close to, say, 75% initiated and over that 70% mark for completed. But starting this week, you'll start to see more numbers in that 5 to 11-year-old range as far as vaccinations. So we discussed that now that it's approved. So our health department is really trying to prioritize vaccinating the 5 to 11-year-old age group. We did open up about 180 appointments, and those filled pretty quickly. We have opened up an additional group of appointments for this week, I think 40 to 50. So we do have some openings for this week if anybody's looking for this week. We just released that information on Facebook. And starting next week, we will be releasing about 400 appointments on Wednesday at 10 a.m. this week. So we are gearing up and trying to get through, offer about 1,200 appointments before Thanksgiving for that 5 to 11-year-old population. Next slide, please. We are still doing adult vaccinations as well. That is at our Cherryland Clinic site. I should note that on the 5 to 11-year-old, we are doing them at the health department, and they're more of a one-on-one type clinic. It's not a mass clinic type situation. So, but for the adult vaccinations, you schedule those separately. That's at our Cherryland Clinic schedule, and it's Tuesday, Wednesday, usually Thursdays, but this week we are closed on Thursday. So you can still get your vaccine or your boosters at that location. And then as far as testing, we weren't able to test this week just due to rolling out of the vaccine for that pediatric population. But I was told just before I got on this call that we will be offering testing starting next week. I think it'll be a couple of days a week. So watch our website for when the openings are for testing here at the health department. And that previously was behind the health department in the parking lot, and due to the cold weather, we are now shifting that over to the Cherryland site on the days that we are not doing vaccinations there. So you'll start to see that shift starting next week. Also on our website, we do have a spot if you do a home test and it's positive and you want to report that. We do have information there and a submit button, and then you will be followed up either with a nurse or from an electronic communication. It's called Patient Education Genius, and it'll go through a quick online form regarding close contacts and some key information for our staff. Also some information on what you should do. And then finally, we can't forget flu vaccinations. We are still providing those at the main health department campus as well. Those are by appointment only. And I did want to point out that there's a tracker for flu vaccine as well. Right now, Grand Traverse County is actually kind of leading the state. We are at about 30%, which is up 10% since our last report in a couple weeks ago. That's all I have today. Thanks.
Thank you, Wendy. Lots of great work going on in Grand Traverse County. We unfortunately don't have Wendy for the Q&A session later on today, but we will try to feed her any additional questions reporters have related to Grand Traverse County, and we can get you some answers that way. But thanks again, Wendy. Great to hear from you. Next, it's my pleasure to welcome back Lisa Peacock, who's the health officer with the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Welcome back, Lisa.
Thanks, Diane. Happy to be here. Thanks for having me. So sort of the same kind of scenario that Wendy described in her health department jurisdiction. Daily cases, positivity, and weekly case rates are certainly have gone up this week over the last week in both of my jurisdictions as well. All of our counties continue to be in that high transmission level. And for that reason, we continue to prioritize case investigations, contact tracing, to make sure that we can quickly isolate and quarantine and reduce community transmission to the best of our ability. Testing also remains a priority. We have testing available through the HANU lab or the health department in all of our counties, all 6 of my counties every week. So, and we are seeing quite a high demand for that testing as well. We are excited that young children are now eligible for vaccination. And we know that if they get their first dose by November 20th, they can be fully vaccinated by Christmas. So we're providing a lot of support for parents with their questions about that. On the bottom of this slide, you can see the links to both health departments that will take you directly to information about pediatric vaccination. Just like Wendy described, we're holding those clinics in our health department buildings. They are available in every county, and you can schedule appointments now all the way through November. And we do have people scheduled throughout. So we have openings. We are happy to see parents and their kids. The way that we are doing it, like Wendy described, is a little different than our mass clinics. It'll be just like our regular immunization clinics, where we'll take the family into an exam room and provide those immunizations privately for kids. We want everyone to know that our K through 12 mask order remains in place for both jurisdictions. We do meet regularly with our school leadership, and due to some questions and just different situations that have arisen and evolved over time, we are making some slight modifications to that order in an amendment that will come out today. Just a couple of really pretty minor changes, just providing a clear definition of appropriate masks, providing an exemption for residential schools if they have an approved mitigation plan in place, and then an exemption for students and officials that are actively engaged in athletics or performing arts during practice, competition, or performances if they are participating in a testing program, which is also described in some guidance that we'll be issuing today. And so, I think those regular conversations continue with schools. One of the hopes that we had was that all children would be eligible for vaccination in that school age population, and they are now. So we will continue working with our schools and our partners and our hospital partners to develop next steps for different phases of those mitigation measures in schools. So beyond that, I don't think that I have a lot else to share. I will be here for the question and answer and happy to participate.
Great. Thank you, Lisa. Appreciate it. Next, we're going to move on to Dr. Jennifer Morse, who is the Medical Director of District Health Department number 10. Welcome back, Dr. Morse.
Thank you. Just like the other two health departments, we've also been seeing some increases in our cases. We have a 10 county jurisdiction, so averaged together, county to county, there's some variability. Our percent positivity is pretty steady. However, county to county, there's quite a bit of variation. It shows there that our average is around 15%, but we have some counties that are actually close to or right about at 25%, 20 to 25%, meaning that out of everyone who tests, 1 out of 4, 1 out of 5 of them are positive. To me, that's a sign that really not enough people are getting tested, meaning that we're missing a lot of people that are truly positive, if that many that are testing are positive. So really want to encourage people, anyone that have symptoms or that are close contacts or just have concerns, to make sure you get tested. There are community testing sites available. We have some set up in Ludington, Mecosta, Manistee, and then other areas are available too. So just a reminder of that. Next slide, thanks. This is just our map showing our zip code areas and vaccination rates. We have right around 55% who have started vaccination that are eligible, and close to 52% who are eligible that have completed the vaccination series. So we certainly could do better. Hopefully we'll see more and more acceptance, and we're hoping to see that 5 to 11-year-old age group presenting for vaccination. Next slide. So just like the other two health departments, we do have the 5 to 11-year-old vaccine available. We started in full force on Monday. Similar setup, we do those in our office in a private room with each family separately. And you can go to our normal site, the dhd10.org/schedule, to vaccinate. There does need to be a parent or guardian present for that visit, just as a reminder. We also continue to have pop-up clinics in multiple locations providing COVID vaccine and flu shots. And so you can go to our events page to find those. Our other resources are available for more information. And we continue to have a public alerts available, and we have a COVID line for people who have questions or concerns as well. And that information's on our website. So I think that is all I have for today.
Thank you, Dr. Morse. Appreciate the update. Yep. And we'll have you back for our Q&A session in a moment as well. Our final speaker today is Heidi Britton, who's the CEO of Northwest Michigan Health Services. Welcome back, Heidi.
Thank you. Thank you for having me. Northwest Michigan Health Services continues to be committed to making the vaccine as easiest as possible for folks to get to it. Continue to work on our pop-up clinics at farms, wineries, and businesses if anyone has a need or desire to do that. Also, we are posting on our Facebook page as well as our website all our scheduled pop-ups and curbside clinics that we're hosting, so the public can go ahead and access both our website and our Facebook to find out where we'll be. A lot of the time right now we're spending at our clinics. So we're now offering the 5 to 11-year-old vaccine, as the other health departments and Munson mentioned. These are by appointment only, and they are curbside. So we definitely encourage kiddos to wear some shorts or a short sleeve shirt under their warmer clothes in order to be vaccinated, and we have them spaced out appropriately. You can find those appointments also by going on our website and just following the links for the COVID information. We have several appointments still yet available this week, so anyone who would like them, and they're pretty accessible till 6 o'clock at night. So hopefully after school is really helpful for families. We're also doing the boosters as well as first and second dose as well. So, and those are also posted on our website. So what times we do separate all adult vaccines from our pediatric clinics. Those are two separate times. So this week we're really focused on our peds and ensuring we get them in as asked for. And testing, just as a note, our testing is being done by a visit by our NMHSI providers or patients of ours, definitely no longer accepting referrals from other primary care providers. That's all I have today. Pretty easy breezy. Thank you.
Thank you, Heidi. Now I'd like to ask all of our speakers to turn their cameras back on and join us for our Q&A session. We do have quite a few questions coming in, especially ones from our local reporters and reporters around the state. So thanks for joining us and submitting your questions. I'm going to start with Dr. Ledke and then open it up to anyone else on the panel. But I think the biggest question is, do we know what are the drivers behind this recent surge? Why are we seeing an uptick in cases now?
That's a good question, Diane. So there has clearly been geographic pockets throughout this pandemic that have had these big surges and declines, and it's not always clear like why one area is affected more than the other. One thing that is clear that we're seeing is that the Delta variant is obviously much more transmissible, and the vaccine, although it significantly decreases your risk of getting infected or hospitalized, it's not as effective against the Delta variant. And it's also clear that vaccine waning immunity is legitimate. So recent studies out of Israel have shown that the efficacy of the vaccine decreases over time related to the age of the patient, the comorbidities, things like that. So even though our vaccination rate is high, we still have breakthroughs, and some of those breakthroughs get sick. So the way I would take that is, if you're eligible to get a booster, I would highly recommend getting a booster, particularly with the high community transmission that we're seeing now.
Thanks, Dr. Ledke. Does anyone else want to comment? Because I think one of the questions as well is, are school-age children part of this surge as well? Dr. Nefsi?
Yeah, I'd say that's definitely true. We're hearing from our local health departments as well as departments around the state that, up to 20% or more of the new cases are in those school age kids. We do have quite a bit of variability in masking. And then, I think all of us can just walk around our communities and see that the mitigation factors that we, had been pushing about distancing and masking and those kinds of things are just no longer in place. So that's certainly part of the issue.
Great, thank you. Moving on to the next question for Dr. Torney. This is one of our reporters, and he states, I have some questions about the oral treatments. Would they be a substitute for the vaccine, or are they treatments for people who have already been infected? And can the pills be used for every age group, or is it just like the vaccine where it will need to go through different trials for different types of doses?
Yeah, those are good questions. So definitely these medications are not a substitute for vaccination. They would be only for patients that are diagnosed with COVID-19, so not for prophylaxis, but for treatment. And the studies, without going into an incredible amount of detail, are looking at patients that have comorbidities, it's not necessarily just the patients that are otherwise healthy. It would be patients that have type 2 diabetes and other disease states, and obviously patients that are symptomatic as well. So it would be essentially an option or another tool in our toolkit, if you will, for preventing hospitalization and preventing progression of severe disease. And again, these therapies are in investigational status at this point, and the FDA and CDC have yet to fully evaluate them, but that should hopefully be in the next few weeks to months.
Thanks, Dr. Torney. Next question is for Dr. Nefsi and what we're currently experiencing at Munson Healthcare. This reporter would like to know, are patients still reluctant to schedule tests, surgeries, and other procedures because of COVID-19? And what are some of the reasons why they would possibly delay care? And obviously, we just announced that we're moving to a pandemic level red. We don't want people to delay care, but are you still seeing that across the system?
It's hard to know the answer to that. We hope not. Through Diane and her team, we've done a lot of work trying to ensure that people understand that we are taking every precaution we can to ensure that our clinics and our hospitals are safe for you to receive care. So we really have been pushing for people to get certainly any urgent or emergent needs addressed, but some of those preventive things that we saw kind of taper off during the last 18 months. So hard to tease out. We often don't find out that information until after the fact. But what we've really been trying to do is direct people to the appropriate level of care. So having them not come to our emergency room for, cough and cold symptoms or just for testing, but to really ensure that they come to the emergency room when they need to come to the emergency room. In all other cases for their preventive care or for minor issues, that they go to their primary care provider, or if their primary care provider is not available, then seek out one of our urgent cares. But that's really been where we've been pushing our efforts. But we really hope that people don't delay necessary care.
And Dr. Nefsi, there's a follow-up question as well. What are the dangers in delaying either procedures or care? And I want to be very clear with people that we're not suggesting that anyone make those decisions on their own. They really need to be made by an expert in their healthcare field to know what's appropriate to delay and what isn't, correct?
Absolutely, yes. Those are conversations you should have with your provider. Certainly delaying care that's necessary can cause a worsening of the issue. And then delaying preventive care can sometimes miss things that, if treated early, are easier. So again, have conversations with your providers about any care that you may need and whether it can safely be postponed or not. And if you have any questions, you can always call our Ask a Nurse office, to sort of figure out, is this a primary care visit office? Is this a urgent care office? But certainly if you feel that you are experiencing an emergency, please don't delay going to one of our emergency rooms.
Thanks, Dr. Nefsi. Switching gears, this next question is for Dr. Morse. It's specific to Mecosta County. This person would like to know, are we making any advances in getting vaccines out to more rural areas of the county?
I guess I didn't realize we had a major issue with doing that. I know we do efforts to have pop-up clinics. I know that we just discussed this morning, making sure that we're addressing shut-ins, people that are homebound. And so if there are unmet needs, I would encourage whoever that is to make sure and contact us so that we can make sure they're being met.
Great, thank you. I know you and your teams are doing everything possible, and Heidi's doing a great job too with her teams trying to get out to all the different areas of need. Dr. Nefsi, did you want to comment on that?
I just wanted to add on to that. I think that the vaccines and the boosters this time around are quite a bit different from the first time when they had it, where, it was often very limited numbers of people who had access to vaccines. And then if you'll recall, we also were sort of triaging those at most risk. I think that it's a very different situation now between our clinics, our health departments, our pharmacies, and other resources. There are actually quite a few available out there for people who would like them. I think Dr. Morse did hit on, those patients that are homebound or have issues with traveling would be the ones that we would want to know about. And we have had conversations between home health and our health departments and the hospitals, as well as primary care providers, about how we best reach those patients.
Great, thank you. I'll take these next two questions from one of the reporters. The first question is, has the federal vaccine mandate for workers changed Munson Healthcare's timeline to vaccinate our workforce? And I would say yes. We just had a meeting with all of our managers and leaders across the system yesterday and announced to all staff today that I could kind of explain this in a nutshell. We originally had a vaccine deadline of January 7th for our healthcare team. Last week, the federal government released two new regulations, one under OSHA and one under the Centers for Medicare and Medicaid. And because of that, we are accelerating our timeline to December 5th to have all healthcare workers have their first, at least their first dose of Pfizer or Moderna or the J&J vaccination by December 5th. We are held to very high standards and with these federal regulations, and we have, as a healthcare system, always complied with all federal regulations. Just please note that the OSHA and the CMS rules do vary slightly. One pertains more to organizations that have more than 100 workers, and the CMS guidelines are specific to healthcare organizations. We must follow the CMS guidelines, so we have absolutely no choice but to try to get as many people vaccinated in our healthcare team with their first dose, at least by December 5th. And we will be doing everything we can to make that as easy as possible for all of our healthcare workers. And we've also extended the deadline for which employees can apply for a medical or non-medical exemption. So we are working with everyone across our health system to ensure that we can continue to deliver high quality care, and especially as we're moving into red status and the numbers are continuing to increase. We'll work on that. And then the second question was, what is the current vaccination rate for Munson healthcare workers? We are excited that we're actually approaching the 80% mark for staff. And Dr. Nefsi, I think it's even higher for providers. It's closer to 90%. Is that correct? Yeah, so we're getting there. Again, that deadline is now December 5th, so we'll be working this month to see how much more we can move the needle on that. So thanks for those questions. The next question is for, I'll start with Dr. Ledke. How much of an impact would a booster vaccine or will boosters have on case numbers and hospitalizations? Do you think the more people that get boosters will actually help with some of the hospitalization rates we're seeing?
Yeah, I think so. This is again based on studies out of Israel, because they happen to be kind of more advanced in regards to the time frame. So they showed a significant decrease in breakthrough cases and new cases in those who have received the booster. Again, we would have to have significant uptake for that. And I think one of the questions is about patients those who don't meet eligibility yet for a booster. I would expect that in probably the next couple of weeks, they're going to expand that to probably every adult. So I think certainly before the holidays, it's going to be something that any adult can get a third booster dose. So I think it has the potential to decrease hospitalization rate, but a significant amount of the population would have to get it. But those who have had it, there's data to support that the breakthrough cases are significantly lower.
Great, thank you. Dr. Torney, one last question from you or for you, and then we're just about out of time here. But what would Munson Healthcare's plans be when the Merck or the Pfizer oral therapies are eventually available and FDA approved? Would we plan to offer those at Munson Healthcare as well?
Yeah, just like any medication, there's a process for reviewing the literature independently. We have several committees that that are multidisciplinary, that would review the literature, review the FDA's recommendation, and set guidance for how those medications could potentially be used in our health system. So that would be the process. And obviously, as soon as that literature comes out and the FDA makes comments and recommendations on that, we would be moving on that as well.
Great, thank you, Dr. Torney, and thank you, Dr. Nefsi, Dr. Morse, Dr. Ledke, Heidi, and Lisa as well. And Wendy did have to jump off. There were a few questions still from some reporters that were asking some very specific questions about some of our numbers and that. We will be reaching out to you. I'll have our media relations team reach out to you with some of that information for your stories that you're looking for. But otherwise, I'd like to just thank all of our panelists right now. And I do have just a couple of follow-up slides that I want to leave you with some information to make sure that you know where to go to get the latest and greatest information. Now, the first thing is Munson Healthcare is hosting a hiring event today at the Del Mar Hotel in Traverse City. Please, if you're looking for work and would love to join a really dedicated healthcare team that's doing some amazing work in our communities and keeping our communities safe, please check out that hiring event. Next slide, please. And as always, we have a full list of testing resources available on our website. You heard from the local health departments, their testing availability. There's also the retail pharmacies out there. If a great resource is to go to the michigan.gov site or call the COVID-19 hotline to ask about testing resources. Again, we're trying to make sure that people aren't just showing up to our emergency departments if they're asymptomatic or just have very mild symptoms and are just looking for COVID testing. We really want to try to conserve those resources for the people who are truly in need of that emergent or urgent care. Next slide, please. And again, the 211 Michigan number is also a wonderful resource. We have all this information posted on our website related to the local health department resources, and you can also go to vaccines.gov. Next slide, please. As Dr. Nefsi mentioned, our Ask a Nurse hotline is great if you just have general medical questions, if you have questions about the COVID-19 vaccine, if you have questions about what's the best place to go for care, or are looking, you're just not sure where's the best place to go, you can call 231-935-0951. And I think I have one final slide, which is our standard one about different ways you can stay connected with Munson Healthcare. In addition to these press conferences, we encourage you to sign up for our e-newsletter, follow us on social media. And again, we keep our website as up to date as possible at munsonhealthcare.org. Thank you for joining us today, and we will see you again in about 2 weeks with further updates. Thanks, everyone.